So this one is story time from about a decade ago. I went to see a gastroenterologist because I was struggling with issues with my esophagus, my bowel, and my stomach. So I attended the appointment. They already had the results of the manometry, which showed that my esophagus was not fine and that my stomach was not fine. The pressures were wrong. And that was fine. So he then discussed it with his colleague, and they were both sitting there, and I was waiting for them to say what they would do or what they couldn't do, or, what the situation was going to look like. And then he says to me, okay, we've got this. What we can do is we can hypnotize you. And I remember thinking, how is hypnotism going to take away all my symptoms and manage the gastroenterology issues? But the doctor assured me that they do hypnotism as like a first-line treatment for gastroenterology issues, and that it works very well. There's no side effects, there's no risks involved, because it will just work. It will take away all your gastroenterology symptoms, and you'll no longer have to worry about that aspect of your condition. He also said it may actually benefit me in other aspects of the medical condition that I have that's genetic. So he said it's like a win-win all round. Nothing can go wrong. It would obviously be a course of sessions where you would be hypnotized, and at the end of the course they would bring you back in and do the tests again, and it would obviously show that there's no issues then because you've had the hypnotism. And I remember being utterly speechless, to say the least. I have a genetic condition called fibrosing ossificational progressiva that has caused the issues with my GI tract. I don't see how hypnosis can overcome a genetic issue that is causing symptoms with the GI tract. I don't understand the medical scientific connection there. So I just started laughing. I said, no, thank you. What can you do for me? But you're not going to be hypnotizing me. And I felt like it was like medicine that day had taken a giant leap backwards to think that you can override a genetic condition with hypnosis. Just didn't seem feasible or correct. It seemed like something from many, many years ago, before medicine knew the things that they know today. Like, it seemed to be like taking a giant step backwards, and I refused to have the hypnotism, but it left me feeling upset because I felt like I went to a major city hospital to be told to have hypnotism that does not work. And we know that scientifically. If I would have engaged in the course of hypnotism, I would have come right out of the hypnotism to have spasms of my esophagus anyway, and issues with my stomach anyway, and issues with my bowel anyway, because it's the nerves. And hypnotism cannot fix nerves that I wasn't born. Like, it cannot replace my nerve system in my GI tract that is damaged and malformed because of the FOP. It literally cannot fix that. So I felt very upset. Like, medicine has taken a giant leap backwards to offer me that as the only solution to the problem, and I walked away extremely upset that day. But the gastroenterologists that I had, the two of them, for the consultation, they were really overjoyed about it, quite happy, and couldn't see the issue in it. They'd offered a solution that was 100% effective, and they believed that it's 100% effective, quite safe, and it works 100% of the time. Because I asked them, have you done the course of hypnotherapy with other people? They told me they'd done it with hundreds of cases, and it had worked in every single case. There was not a single case it hadn't worked for with regards to gastroenterology and genetic issues that cause problems for the gastroenterology tract. I don't believe it was 100%. I believe I was lied to about those figures. And they tried to sell me something that doesn't work. And that's pretty upsetting from a major hospital that should have known better and should have realised how unsafe I was. Okay, so continuing the video, since I was pretty sick, I had to put a break in and see it myself because I'm pretty sick with a chest infection due to a lack of working J-tube and the aspiration. So anyway, let us continue the video. So after they offered me the hypnotism and I didn't take it up, they then offered me a low-FODMAP diet. They then told me that the low-FODMAP diet, it's great because, again, there's no side effects, there's no issues. You literally just go on this special diet. 100%, it works 100% of the time. There's nobody that a low-FODMAP diet doesn't work for. They've had no issues or complications with it, and all of the patients that they've put on a low-FODMAP diet, it has worked for. So you don't so they were like, you don't need to worry about your gastroenterology issues anymore because the low-FODMAP diet will take care of it. I then told the doctor, well, like, I've been on the low-FODMAP diet for 5 years. I think if it was going to work, would have already worked. And that shut him down pretty quick because he then realised he couldn't sell me the diet because it just wouldn't work. I'd been on it so many years. If it was going to, it would have already, and he suddenly realised it just wasn't going to work. And I mean, I knew it wasn't going to work to continue with the diet because it wasn't addressing my issues or my need to be fed safely. It wasn't addressing the aspiration or the chest infections. It was addressing none of my gastroenterology concerns. That's why I was sent to them. If they could, like, read the referrals and read your patient information and take it on board, then it would have saved a lot of issues, with the gastroenterology team. The part is, so even though they offered me the low-FODMAP diet, once they realised I'd been on it for a considerable amount of time and that it wasn't working for me and that it wouldn't work, they didn't offer me anything else. The same as with the suggestion of hypnotism. When I didn't take it up because it wouldn't work for me, they never offered me any other solution. And that was upsetting. They didn't try to help me in any way.